And for we some disorders like in splenomegaly, there may be a increase in the destruction of platelets, and so those were some a little bit about platelet disorders. So the next topic I want to talk about is uh, inspiratory dyspnea and stridor. So in inspiratory dyspnea and stridor, it means that there is a obstruction in the upper respiratory airways, causing a sound when you are taking in breath, and it can cause difficulty due to this obstruction. And the main causes can include things like a foreign body aspiration or epiglottitis or upper um, subglottic laryngitis like croup. And so for the first disorder, epiglottitis, we can see a swelling in the epiglottis. This is an acute condition that's usually caused by bacteria, and they can include things like Haemophilus influenza B or um, uh, Streptococcus pneumoniae. And uh, we can find symptoms such as difficulty breathing or um, leaning forward, a child that is quietly breathing or has his jaws thrust forward. And on X-ray, on the cervix, we can see a swelling in the epiglottis, and performing a tongue depressing using a stick or bronchoscopy may further make the suffocation or obstruct the airways, so they shouldn't be performed. And instead, you should perform things like intubation or tracheostomy, or if you have the equipment, or if not, then you could perform a epiconiotomy and basically stabilize the patient, and also give some steroids in order to reduce the inflammation. And so those can cause inspiratory stridor and dyspnea. And in croup, although there may not be a complete obstruction, there may still be a stridor, such as a barking cough. And croup is usually caused by viral causes such as parainfluenza and influenza virus. Uh, and in this disease, we can treat it by giving steroids as well uh, to reduce inflammation. Also, give some oxygen and stuff if needed. For foreign bodies, there can be some small objects that the child can aspire and may cause dyspnea. If there's something dislodged within the bronchus, and if he's an infant, then you can uh, put the child upside down and give some back thrusts, uh, which may dislodge the foreign body. Or if the child is older than 1 years old or is a pretty old child, then you can perform Helminth maneuver, which is basically you use your hands to thrust the abdomen. And in newborns, this may damage the livers and intestines, so it's not performed. But in children, it can be used to dislodge the material. And and if needed, then some things like CPR may be performed if the child is really in serious conditions. And in children or newborns, CPR is done based on whether if the child breathing normally or is not, is has signs of cyanosis. and clearly is not breathing properly and um, has uh, has signs of apnea. And when these signs are given, then you should secure the airways and give one breath per three compressions. And the compressions should be done on the chest with thumbs, or if there's only one person, then you can use fingers to depress the chest. And this can be done to continue. Uh, this can be done in an emergency situation in order to maintain the airways and the circulation of the child. And for the next topic, genetics of immunodeficiencies. Um, so for this topic, I'll talk about the different types of genetic disorders that can affect the immune system. And the immune system is basically white blood cells. It can be either natural or acquired, and natural are things like from your mother, and you can no, I mean from yourself, so like your B cells and T cells and leukocytes, and these can all perform functions like phagocytosis and killing these infections, while B cells and T cells are involved in these antibodies and cell-mediated toxicity. While acquired can be things like in from your breast milk, you can get IgA, while in placenta, you can get IgG. And all these things will basically be involved in the genetics of immunodeficiencies. And some disorders associated with immunodeficiencies. I'll start with the first genetic disorder, which is ataxia telangiectasia. This is a disorder where in newborns you will have ataxia of, so you will have poor coordination and eye movement disorders, and skin capillary telangiectasias, and it will show in the sclera and skin and in the mucosa. And also there will be a deficiency in the function of IgA. So there will be a low level of IgA in the body, and IgA is important for things like in the intestinal immune system. And these when you are lacking in ataxia telangiectasia IgA, then there may be some disorders associated with the gastrointestinal system, like infection there. And also in the respiratory system, like pneumonia or sinusitis and otitis media may also happen as a result. And some treatments can be things like by giving IgA, or giving some hematopoietic stem cells uh, in order to prevent early death. Another can be severe combined immune deficiency, where there is a deficiency in B cell and T cell function, and more so in T cell functions. And there will be a deficiency in the ability to clear viruses and fungal infections, and some certain aspergillosis, as well as certain intracellular bacteria like tuberculosis and Legionella, no, Listeria. And this will lead. This is usually due to a a genetic disorder that is associated with deficiency of uh, uh, ADA protein, and this can lead to a lack of this function in the T cells and can lead to severe immunodeficiencies. Another one would be DiGeorge syndrome, which is another disease due to a mutation in 22q11.2 gene, causing a lack of thymus and a parafollicular parathyroid cells, and this lack of thymus will lead to a poor differentiation of uh, immune lymphocytes and cause a overall immunodeficiency. And also another disorder can be some X-linked X-linked agammaglobulinemia, and in this disorder, we it's an X-linked recessive disorder, and there's a congenital lack of production of immunoglobulins by B cells, which will lead to a deficiency in humoral immunity. And humoral immunity is important for clearing these pathogenic bacteria such as Streptococcus and Staphylococcus aureus. And so, but however, the T cell functions in agammaglobulinemia will be preserved, and therefore these infections by viruses and these intracellular organs will be preserved more or less. In and there are some other many other disorders such as Wiskott-Aldrich syndrome or such as Wiskott-Aldrich syndrome that can also lead to other uh, types of immunodeficiencies. Um, and for the last topic, I want to talk about is some respiratory disorders in newborns and perinatal hypoxia. So some respiratory disorders in newborns and perinatal hypoxia should uh, is any disorders that will happen around birth that can either be life-threatening due to uh, poor oxygenation of the blood of the newborn, and perinatal hypoxia is also when you have a low level of oxygen in the blood and can lead to several disorders and can be life-threatening if not treated immediately. So newborns have a poorly premature developed respiratory system, and the brain is also not completely developed, so it may be prone to hypoventilation due to hypoxia. And also, the airway is very small, and diameter is very small, and can be prone to many different types of respiratory disorders in newborns. And some uh, examples of disorders that can happen are, especially in newborns, there may be a uh, poor hyalinization of the lungs and a lack of surfactant production due to surfactants being produced late in pregnancy, and a premature birth or a very low birth weight below 1 kilogram may lead to a lack of surfactants, and surfactants are very important for the lowering the allowing the lung to refill, uh, and it's made of lipoproteins and phospholipids that are uh, composing the surfactants. And when you have a child like this, then the child may, as soon as the child is born, it may suffer from respiratory distress syndrome, and some urgent interventions may be necessary to treat these patients. And for example, you should perform either CPR uh, or apply surfactants the through the trachea, and also mechanical ventilation may be necessary. Uh, CPR, as I mentioned earlier, is in newborns are performed at a rate of 1 breath per 3 compressions, and therefore in 1 minute there would be 30 breath and 90 compressions, and and yeah, and the circulation of the newborns must be maintained. Some other causes of obstructions may be things like congenital choanal atresia, where there is a lack of formation of the choana, which in newborns who are obligate nasal breathers, they may require breathing from the nose, and this obstruction or the atresia will quickly lead to hypoxemia. Also, if you have a lung hypoplasia, which can be due to a lack of proper growth in intrauterine period, will also lead to death because there's no way to properly oxygenate the lungs and the blood. And these are usually due to problems such as Potter sequence or oligodramnios, which is the low level of water in the amniotic sac, or problems like which is due to things like renal agenesis or tracheal atresia or bronchial atresia, which will not allow the amniotic fluid to fill the lungs and form these the lung properly. And some other there could be many other causes that can cause hypoxemia, uh, and hypoxemia can be due to cardiac causes, which or pulmonary causes, or some other causes like and some to start with cardiac causes. There may be some kind of heart malformation, uh, congenital, like if you have a ventricular septal defect or a transposition of the pulmonary arteries and the major arteries, or uh, things like aortic dissection or lack of formation of the aorta may also cause hypoxemia due to poor perfusion of the peripheries and the distribution of blood. And in a ventroseptal defect, there may be a shunt from the left to right, and this may cause things like heart failure due to hyper high output, and may cause conditions like erythroblastosis fetalis due to, I mean, may cause heart failure. And another cause could be things like of heart failure, could be things like erythroblastosis and hemolytic anemia. And for pulmonary causes, so as I mentioned, uh, things like lung hypoplasia can be a problem, or if you have a uh, uh, actually, yeah, that's it.